Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal video today. We just got one patient who came through on Monday this week. Very narrow ear canals for this patient. So we're actually going to use what they call a fine end. Now, a few people have mentioned that they don't really get the size of these different tools. So what I've got here, this is a fine end. So if I try and hold this up to the camera, so if I hold it that way, it's probably a bit easier. So this actually fits onto the end of a standard size ulnar tube. The diameter at the top is really thin. Let me see if I can put my finger sort of just so you can get a rough idea, there you go, of the size. So I've measured this myself. It's 1/16 of an inch wide from outside edge to outside edge, so just over 1 millimeter. So we're going to be using this one quite a bit. That's going to give you some frame of reference as to how narrow this ear canal was for this patient. The other thing we're going to use today is the Jobson horn. Now this is an oval Jobson horn. Okay, you can get them in round or oval. This is the oval. We obviously by the shape on the end there. You can see that it's got a very, if I put my hand behind it, very sort of slight bend on the end there. So we're able to get over the top and to bring that wax out. So I talked to you about there being a slight bend on the end of the Jobson horn. That's what it's referring to. So without further ado, we'll pop on to today's video. So basically this really lovely lady had come through, feeling really blocked up on one side. You can put lots and lots of different home remedies in there to try and get rid of this. But you can see the entrance to the canal is a very fine end. Now that is actually a fine end there. So you can see just how narrow this ear canal was. So you're talking that is 1/16 of an inch, just over 1 millimeter. So it's very narrow. So what we're having to do here is to hold the ear canal open. We're using the endoscope or the side of the endoscope to actually hold the ear canal open so we can get inside the canal. We're just very slowly working our way down. You do see a lot with these very narrow canals like this, because the wax just can't migrate out. You imagine it's trying to get out to a really narrow space. It can't get out very well. So the wax does tend to sit in there and dry out and become really sticky and just really kind of hold in place there. But you can actually see as we're suctioning this in, there are lots of little bits of sort of dead skin and debris coming away on here as well. So we're just slowly guiding this down. It's always a painstaking procedure when you try and suction somebody with a very narrow canal like this one. You can see we're just trying to lift and peel down the canal all the way down just to try and get some relief for this patient. You can see the skin layer is actually just separating where the dead skin's coming away off the top layer there. See, as you stretch, you get this thin sort of spiderwebby film just underneath where it's slowly peeling down. There you go, just trying to get hold of this harder piece. One disadvantage of using the fine end, it's great when you've got very narrow canals like this, but you don't get a tremendous amount of suction grip because you're you would think it would be the opposite way, but because you're forcing that sort of airflow through a much narrower tube, you'd think you get a lot more suction. But what tends to happen is it blocks very easily and very quickly, especially if you have sticky wax, which we've just encountered here. You can see it's coming away. The sticky wax just gets to the end and blocks it very fast. So we've got rid of that outer skin layer, but you can see that all this softer, mushier, stickier type of wax sitting behind it. So just very slowly bringing this out. Always really conscious with patients with narrow ear canals that you try not to touch the canal walls at all because they are quite uncomfortable if you press against them. Don't forget it's very thin skin in there with nerve endings just below the surface. There we are. You can see you just starting to chip away at the bottom now. Trying to just try to lift up as much of this as we can. It's not like using the standard size tube where you could sort of lift a lot and get a good grip on that to pull it forwards. You're just slowly chipping away at the wax with this type of tube. There's a little hair actually in there that's just going across the tube there as well. You can see that kind of slight pinkness to the skin. This last section of wax here, very deep. So sitting really close to the eardrum, very difficult to get to. There we are. We're just trying to trying to pull down on it, just trying to roll it forwards if we can. We haven't got a great deal of kind of, if you imagine, side to side movement in here. So the best one we can do is up and down movement with the wiggle, just to try and kind of bend this forwards and bring it out. Thank you to everyone as well who said they would like to see this particular type of format continue. Yep, that's great. I'll carry on with that one. I know some people had mentioned they had a few difficulties with some of the audio, so I've changed mics. So if you could just let me know if that's any better for you guys. It sounded better on the playback when I did a quick test earlier, but just to make sure it's all sounded okay for you. Very slowly, you can see it. It's difficult to get that pulling sensation, especially when you get these problems with his skin involved as well, because the skin is tough. It doesn't break away like the wax does. So as you're trying to pull it, you kind of stretching it. And normally, if you've seen our videos before, we've done like an ear canal peel. We lift quite high into the canal to get the peel, but you're just so restricted in your movement here with this ear canal. Trying to lift from the bottom. Can you see we're just getting a little bit of movement now to the wax, with the whole thing just starts to move. Now you know then you've loosened it. It's starting to come away. Oh, it's almost there. We're just going to try and pull this down. It's frustrating. Little bits are breaking off the top, which is blocking the suction, but it's very slowly coming down. Just going to clear the suction tube. You do find, obviously, using the fine end, you have to clear quite a bit. There we are. Just see it starting now. We're getting that roll. It's just starting to go. There we go. Now we're starting to see a bit more movement. There's light at the end of the tunnel now, guys. It's almost there. So now we've just got that. We're just rolling it over. And now lifting from the bottom again. You can see what I mean about it being really sticky, and we've actually blocked the suction again now. So we have to, you have to repeatedly come out and clear through this. Bits of skin, they're just getting sucked in. There we go. So we're starting to move now. We've got to the outer part of the ear canal. Out that bit comes. That's great. It's going to give us a bit more room in there. Unfortunately, there is more wax behind. We're just starting to see the tip of the hammer bone there, though, just at the top of the canal. You can see just how narrow that entrance is. These patients would normally be coming through on a regular basis. You'd see them probably usually about every sort of 2 or 3 months if you've got very narrow canals like this. Just because of the nature of the wax and the size of the canal, they tend to block up very quickly. So we've managed to spin that wax now, so it's kind of turned through 90 degrees, but we've got a very thin leading edge, if you see. So we've already got the thin end in there, and the thin leading edge of this wax means it's really difficult to get a really pronounced grip on it. And you can see it's just collapsing, breaking away. It's all untangling and peeling, which is going to be a nightmare to try and pull out. I'm trying my best to get it, if we can kind of get it forward slightly to a slightly wider part of the ear canal, then we can use the Jobson horn then to get over the top and bring it forwards. But when you're in a very narrow part of the canal, you saw just a second ago when I showed you the Jobson horn, but because of the shape of it, sometimes it's difficult, especially in narrow canals, to get that angle. You need to pass over the top of the wax to pull it down. Still trying to roll it, but you can see what's happening is the wax is just disintegrating and then sticking to the canal walls either side as we're trying to pull it. I'm searching for any harder, slightly more solid pieces of wax so we can get a good grip on. You can see as we lifted it from the bottom, then we saw a little bit of it coming away. Okay, so Jobson horn to the rescue. You can see it's coming over the top. We've managed to get just over the top of it, pull down behind it and draw it through and out of the canal. Yeah, you can see a little bit more. With Jobson horn and those kind of wetter types wax, the more wax are more easy to sort of disintegrate, if you like. You tend to find sometimes it will kind of smear it to the canal wall. So I tend to go in with a Jobson horn, then go back in with a suction, tidy up a little bit, and then we can go back in with a Jobson horn again if we need to. But we've managed to, now we've broken that front section away, that thinner piece then come away quite nicely. You can see it really struggling to get the endoscope in. There we are, there's the eardrum now. And so this is what we removed. So you can see it's not a tremendous amount. Oh, it's quick look this before it goes off the screen. 5/8 of an inch, yay. Just over 1.5 centimeters there as well. So you can see very, very small pieces. But when you look at that in comparison to the size of the ear canal, it makes it makes a massive difference for these patients when they're kind of really getting really blocked up with this stickier, firmer type of wax. So I hope you enjoyed seeing the tools we use. If that's something you'd like to see more often, so if I give you a rundown of the tools we're going to use and show you them before we start, let me know, because obviously you guys drive what we do on this channel and you're really good at it. So if you tell me what you want to see, pop it into the comment section below. I am reading them, I promise. We're just so busy at the moment. I'm struggling to keep on top of responding to everyone. But let me know what you'd like to see, whether you want to see the tools again next time, or maybe you want to see the endoscope. We can show you that if you want to see that next time as well. Yes, as always, guys, take care. If you did enjoy the video and you're not subscribed already, if you don't mind subscribing, that would be fantastic. Don't forget to hit the bell. That way then you get a notification every time we upload. And check us out on Facebook, and we're also on Instagram as well. Okay, guys, stay safe, and I shall see you on Friday.